welcome to everyone. Or thank you for welcoming us to your home, actually. We're so glad that Professor Tom Rzeznik, Professor of History at Seton Hall University, is with us today to tell us about the ups and the downs and the ins and the outs that led to this wonderful new book, which is just about in the bookstores, right? It's, I think, maybe 2 days away or something, or June 2nd. Great. Okay, so we have a few advance copies of the book already. We welcome in particular our sisters at Cathay who are watching us via live stream. So without further ado, I will let Professor Tom share with us the story of St. Vincent's Hospital and the book that he wrote about it. Thank you, Tom.
Yes, thank you, Sister Regina. I'm so excited. The official publication is June 2nd, but just this past weekend, my advanced author copies arrived, so a box landed at the doorstep, and so I shared a copy with the archives and with Sister Regina, and kind of there's one here for people to take a look at if they wish. But it is a real honor and a delight to be able to share my work with all of you. And I will admit, this is a little bit intimidating to tell you your own story. What do I know? But in all seriousness, I am really privileged to be able to tell the story of St. Vincent's Hospital and the remarkable contributions of the Sisters of Charity and all those who worked alongside them to care for those in need. That is the focus of the book. So before I begin, I do need to start off with some thank yous, to express my thanks to the Sisters of Charity, all of you, for welcoming me as a researcher and granting me access to your archival collections. The book would not have been possible had you not been gracious in sharing the history that you had collected and preserved. As a researcher, I'm grateful to the archivists who helped shepherd me through those collections. So that includes the late Sister Constance Brennan, who first welcomed me to the archives, then Sister Mary Ellen Blumlein, and now Mindy Gordon, but also all of their predecessors who had worked over the years to maintain those collections, to move them around from the hospital up here to Mount Saint Vincent's and everywhere else where they lived. And I have a special debt to all of the sisters who recorded the history, those past sister historians who helped write earlier versions of the history of St. Vincent's Hospital and the Sisters of Charity. Those were incredible resources for me as a researcher, helping me better understand the story that I was telling. When you write a book, you can't help but fall in love with the subject that you're writing about. And that may sound a little bit odd for a hospital. I mean, after all, most people don't love going to a hospital. Nobody ever wants to spend time in a hospital. But as I was doing this research and I was to tell people that I am researching St. Vincent's, the same comments came up over and over again. People telling me how much they loved St. Vincent's, how much they appreciated St. Vincent's, how St. Vincent's was there, a part of their lives, their family's history, how it was always there to care for them in need. And so I could feel the love and the appreciation that those who worked at St. Vincent's, those who lived in Greenwich Village, those who had an encounter with St. Vincent's, that love that they had for the institution. And it was infectious. And in the process of writing the book, I too fell in love with this hospital. And that was a bit of a transformation to me because I had no personal connection to St. Vincent's Hospital before I began working on this book. People asked me how I got interested in this topic, how I got started. I did not grow up in Greenwich Village. I never lived in Greenwich Village. I had never been a patient at St. Vincent's Hospital. I never visited anybody at St. Vincent's Hospital. I did not become interested in the topic until after it closed. I'm a historian of American Catholicism, and I've always been interested in institutional histories. And I was teaching at Seton Hall University. I had just finished up one project, and I was looking for another project when news of the hospital's closure kind of hit the front page of the newspapers and the news reports and everything like that. And it just got me thinking that, wow, here's a story to be told. This was New York City's first Catholic hospital, and it was New York City's last Catholic hospital. So here was an opportunity to explore the history of Catholic healthcare through the lens of one institution. And there were many, many, many Catholic hospitals that are deserving to have their history told. But St. Vincent's was truly unique. When I got started on the project, I did not know what I was getting into. It really is a storied institution. It was there. It was part of the life of New York City as the city was developing and growing. It's the story of the hospital, but it's also the story of the Catholic Church in New York City and the Catholic Church in the United States, and the remarkable work that women religious did to build up hospitals, schools, welfare institutions, and really just became the public face of the good works of the Catholic Church. So I came into this project knowing that part of the story, knowing kind of the general history of the Catholic Church in the United States, but this gave me an opportunity to really explore one institution in a kind of a really in-depth, fine-grained analysis. And I was lucky that there was so much richness in St. Vincent's story that the book almost wrote itself. It didn't. It took a lot of time and effort and revisions, especially when the press limited me to 100,000 words, and I had to sort of go through, very strategically in order to decide what to keep, what to I sort of unfortunately have to sort of save for another time. But it really sort of came together as a remarkable project. So let me just start with a little bit of background. Some of you are probably familiar with the history of St. Vincent's, but perhaps there's some who are listening online or later on for the recording of this talk. If somebody tunes in, maybe they're not going to be as familiar with the story itself. So a bit of background. St. Vincent's Hospital was founded in 1849 by the Sisters of Charity of New York, a branch of the religious order established by Elizabeth Ann Seton. It was New York City's third hospital, after Bellevue, which was a public almshouse, and the New York Hospital, which was a private institution. St. Vincent's was founded in response to a cholera epidemic, one of the great scourges of the 19th century, particularly among the urban poor and the immigrant classes. The hospital began with 4 sisters who took up the work in a rented townhouse, equipped with 30 beds and not much more. So the photograph that's there to your left is sort of a drawing of that first townhouse where the Sisters of Charity began the work. That townhouse had no running water, no bathing facilities, no heat except for a small stove in the basement, and barely any space for the sisters, who slept on mattresses that they laid out on the floor of one of the rooms that they reserved for their living quarters. Candles and lamps provided the necessary illumination. The sisters took it upon themselves to care for the sick, to haul water, to wash soiled linens, to prepare meals, as well as to assume responsibility for the hospital's administration and finances. The other image that you have on the screen in front of you was the first ad for St. Vincent's Hospital, a prospectus that was published in newspapers in November of 1849, simply announcing the opening of a new hospital. And this was often buried in the back of the newspapers. You would think the opening of a hospital would command headlines, be front page news. This was sort of tucked away in the back with sort of sort of shipping reports and ads for quack medicines and things like that. But here was this announcement of the opening of a new hospital under the charge of the Sisters of Charity. And I was really struck that there was no explanation of who the Sisters of Charity were. So it's reflected something about how the name and reputation of the sisters already in 1849 meant something in New York City because of their earlier responses to cholera epidemics and other moments of need. So there was the opening of the hospital. Not much in terms of fanfare, but it was the seed of something greater. By the 1960s, St. Vincent's had become the largest Catholic hospital in the United States and the largest religious-sponsored hospital of any religious denomination. It had more than 800 beds at its peak. It stood at the heart of Greenwich Village, responding to the needs of the city as it grew. In the book, I trace the history of the hospital from its founding to its closure. But I also wanted to sort of show off the evolution of the hospital. So the organizational structure of the book kind of unfolds in 6 parts, tracking sort of 6 different moments in the hospital's history, or I should say 6 different eras of the hospital's history, thinking about how St. Vincent's as an institution evolved over time. The photo that is there is St. Vincent's at its peak after its post-World War II expansion, where it sort of had grown to occupy sort of half of a New York City block, with this assemblage of buildings sort of cobbled together, some going back to the kind of 1905 with the Seton building, which was the one that's in the very foreground of the image. That was the old ward building, but then kind of new buildings started to surround it. And so by the late 1960s, it was this sort of impressive campus. The book traces kind of the growth of St. Vincent's from its earliest days when, what did it mean to be a hospital? St. Vincent's was largely a refuge for the sick and the dying. Given the kind of very limited medical care that would have existed at the time, St. Vincent's needed to sort of just take people in and offer a bed. Sort of hope for a cure was welcome, but often elusive. So the first era of the hospital's history was that sort of the hospital as a refuge. But then in the post-Civil War period, hospital expansion in the United States starts to take off. St. Vincent's becomes a sectarian charity. Different religious groups all sponsored their own hospitals. So in New York City, you had St. Luke's, sponsored by the Episcopal Church. You had Presbyterian Hospital, Methodist hospitals, Jewish hospitals like Mount Sinai. And so St. Vincent's was the Catholic hospital. It was responding to this desire on the part of the church and the sisters to care for their own, often for Catholics who faced discrimination when they went to other hospitals. So that was kind of the second iteration of the hospital. Then in the early 20th century, St. Vincent's repositions itself and becomes a community institution. Its doors had always been open to all in need, Catholic or non, but by the 1910s, 1920s, it was becoming the village's hospital. Things like ambulance service meant that people no longer chose the hospital, they were taken to the closest hospital. So St. Vincent's expanded its ambulance service to basically cover much of Greenwich Village, Chelsea, and the lower side of Manhattan. Things in the 1930s, they expanded their outpatient department and built a new clinic building, which they promoted as the village's doctor. You know, it was a place where people, you didn't necessarily need to be hospitalized, but you needed medical care. So those outpatient clinics provided vital medical needs. And that became really important in the 1930s because New York Hospital had moved from 15th Street further north. The lying-in hospital, a maternity hospital, had moved out of Greenwich Village. So that left St. Vincent's as one of the few major hospitals in that section of Manhattan. So it took on this new role. And it was at that moment that kind of the connections between St. Vincent's and Greenwich Village really started to cement. Then after that, after World War II, St. Vincent's became New York City's flagship Catholic hospital. This was sort of under the leadership of Sister Loretto Bernard Began, who was the hospital's administrator from 1939 to 1959, overseeing kind of the construction of several new buildings and the expansion of medical programs, but also at the encouragement and the support of Cardinal Spellman, who was a big champion of St. Vincent's Hospital and believed that his archdiocese needed a Catholic hospital worthy of kind of the status and the reputation of the Catholic Church in the United States as he understood it. So he helped sort of direct support towards St. Vincent's Hospital through Catholic charities, through philanthropy, and other means. So it was a really kind of symbiotic partnership between the Archdiocese and the Sisters of Charity during those years. During the 1960s and 70s, St. Vincent's repositioned itself as a medical research center. So they expanded not just medical practices, but scientific research. So it became St. Vincent's Catholic Medical Center, not simply a hospital. And then in the 1980s and 1990s, St. Vincent's became part of a kind of the anchor for a Catholic healthcare network in New York City. So this was a new phase in the hospital's existence, when kind of the idea of a standalone independent hospital became increasingly difficult in the era of healthcare consolidation and the development of major medical systems, not just within kind of secular counterparts, but the development of larger Catholic healthcare networks, Dignity Health, Sisters, sort of the Sisters of Mercy and Mercy Health East, and those sorts of organizations. So kind of there is kind of the book as it unfolds, sort of showing how St. Vincent's had kind of different iterations over the years and how the sisters managed to steer this institution. Woven throughout all of that is just memorable moments in the life of New York City. St. Vincent's history is just so incredible because it was there to see so many events in the life of New York City's development, from caring for the famine Irish and waves of immigrants. St. Vincent's also cared for those who were victims of industrial accidents as New York City was developing as an industrial center. So one of the most famous was the Triangle Shirtwaist Factory fire in 1911. The fire was in Greenwich Village, and many of those who were sort of rescued from that tragedy were taken to St. Vincent's. Later on, the Titanic. When news broke of the sinking of the Titanic, the sisters at St. Vincent's sent a fleet of ambulances down to the docks. They contacted the White Star Line, saying that the hospital would be ready to take anybody in need, but especially the poor. So St. Vincent's brought in many who would have been the steerage passengers. That was part of their commitment. But it was also the sisters who went with the ambulances down to the docks and sort of stood vigil with family members who were waiting for news of loved ones. That was part of their ministry as well. Later on, many in Greenwich Village continue to remember St. Vincent's for its heroic role in the AIDS crisis of the 1980s and the 1990s. It is still remembered to this day for the work that was done. And then, of course, 9/11. St. Vincent's was there, the closest hospital to the Twin Towers. And when news of that tragedy was known, the hospital immediately mobilized. Doctors, nurses, staff standing, waiting outside the doors of the hospital. Sadly, as they discovered, there were no survivors to be treated. But the hospital was there. It was present to the community, it was present to the city. And this is all part of its history. St. Vincent's also has many firsts and notables. Not only was it the first Catholic hospital in New York City, it was the first New York City hospital to offer accommodations for private patients. It was the first to have a motorized ambulance which admittedly did not work out very well at first because the motorized ambulance was not as good as the horses for getting through crowded Greenwich Village streets and cobblestones. But when a donor graciously offered to give St. Vincent's a motorized ambulance, the sisters graciously welcomed that. But it was really kind of the start of kind of the ambulance service for the hospital. St. Vincent's was the first to have a cardiac intensive care unit. It was the first Catholic hospital on the East Coast to have a psychiatric division as part of a general hospital. The sisters have been doing sort of psychiatric care with St. Vincent's Westchester for many, many years before that, but it was the first to have kind of an integrated psychiatric division. St. Vincent's had one of the most highly regarded, it was one of the most highly regarded teaching hospitals in the country, and it had one of the largest hospital schools of nursing in the country, with a really distinguished reputation of training young women to be St. Vincent's nurses. That was a badge of honor that they wore proudly. And there was even some remarkable competition to get into the hospital's School of Nursing. One of my favorite archival finds, I was over at the archives for the Diocese of Brooklyn. And I was just kind of like, okay, I'm interested in Catholic healthcare in New York City, what do you have? And the archivist said, oh, wait a second, there's a folder marked St. Vincent's Hospital in with the bishop's papers. Let's go see what that is. And so I'm forgetting the date, but sometime in the 1950s, sort of get this envelope, this folder, and it has sort of just one letter in it. And it was a letter from a mother to the bishop. The mother's daughter had applied to St. Vincent's Hospital School of Nursing and unfortunately was not accepted. So the mother wrote to the bishop, hoping that the bishop would be able to help the daughter fulfill her dream and maybe have some sway over the hospital's admission standards. Not so much. But it really spoke to kind of this reputation of the School of Nursing, because there certainly were other Catholic schools of nursing that the young girl could have gone to. But she wanted to be a St. Vincent's nurse. One of the other things to say about the book, just as an introduction, the title is A Monument of Charity. I took that phrase from a 1904-1905 pamphlet that was produced as part of a fundraising drive for what was then known as the Ward Building, later on the Seton Building. And so that pamphlet was titled A Monument of Charity. And that title really just stuck with me. I thought it was a beautiful illustration of what St. Vincent's was. And I liked it because it had this double meaning. Well, I liked it because it incorporated the word charity, so it was a tribute to the Sisters of Charity. But it also had this double meaning that here is St. Vincent's in the brochure. They're talking about all of the wonderful charity that the hospital offers, the care that it provides for the community, the care that it provides for the poor. So it was St. Vincent's as dispenser of charity, but it was also an appeal for funds. So it was recognition that St. Vincent's, in order to carry out its charitable mission, relied on the charity of others, the Catholic community, the Greenwich Village community, and other benefactors. So it was the way that the sisters both received charity, but then used that in order to perform charity. And reading through that brochure, you go through and talks about all the wonderful work that's done at St. Vincent's. It's about the sisters and it's about the nurses. I think the doctors get about one sentence in there. So in the book, in addition to celebrating St. Vincent's history, there are a couple sort of themes that I try to emphasize. Making sure I have the correct slide there. One key theme throughout the book is mission. And this is one thing that I hope that I'm able to offer as a historian of American Catholicism, to really emphasize kind of not just the history of health and medicine, but the mission that the hospital performed over the years for more than 160 years. The image there is the sort of stained glass window of St. Vincent de Paul that was in the ward building, and is since, after the hospital closed, this was transferred to sort of St. Joseph's Hospital in Paterson, New Jersey, if I'm remembering correctly, and the Sisters of Charity of Convent Station, New Jersey, now have kind of this stained glass window entrusted to their care. But that window that greeted people when they entered, sort of that stained glass window that greeted people when they entered the ward building, was a reminder of the fundamental mission of the hospital. St. Vincent's was there to serve the poor, to serve the marginalized, to serve those who had nobody else to care for them. When the hospital was established to take in the poor, it wasn't just a sign that somebody lacked financial means, but to go to a place like St. Vincent's in 1849 often meant that you didn't have family or social relations or somebody else to care for you. So the hospital was there to provide bedside care, to have somebody to hold your hand in that moment of need, to recognize you as a fellow human being deserving of care. So emphasis on mission runs throughout the book, rooted in the example of St. Vincent de Paul, St. Louise de Marillac, and the Daughters of Charity, both in France and here in the kind of the Sisters of Charity in the United States. This focus on caring for the poor was a radical stance in an era when quality medical care remained largely a private good enjoyed by those who could afford it. The new hospital would not be like other institutions that regularly discriminated against the poor or subjected them to shameful conditions. St. Vincent's never turned anybody away, from its founding day all the way until it closed. That included the immigrants, included the homeless, included the homebound elderly, those dying of AIDS, and anybody else who was brought to them in a moment of need. When talking about Catholic healthcare today, news accounts often focus on the services that Catholic institutions do not provide. But the history of St. Vincent's encourages us to recognize the distinctive elements that Catholic hospitals and other faith-based institutions have offered. They challenged the prevailing logic of healthcare in the United States by offering indiscriminate care. There was no means testing or moral scrutiny. Catholic hospitals refused to give up on charity care when many other private institutions set limits on the amount of free care or the amount of allowances that they provided. And the sisters sometimes had to push back against the board of trustees and the other advisors and the financial experts who said that they were being foolish by giving away so much care. But still, they persisted. St. Vincent's and other Catholic hospitals set an example for humane, compassionate care. It's not just about treating an illness, but treating people with dignity. Catholic institutions also became advocates for reform. St. Vincent's and the Sisters of Charity held New York City accountable for the care of municipal cases and made sure that the city properly reimbursed the hospital for the care that they provided. Later on, Catholic institutions became important in advocating for other reforms. When St. Vincent's established the supportive care program for those dying with AIDS, it was set up as a hospice program, but reimbursements for hospice only covered home-based care. That was the idea of hospice. There was no provision for hospital-based hospice care. And so St. Vincent's, under the leadership of sort of Sister Patrice Murphy and others, fought to have hospital hospice care covered because they knew that many of the patients that they had no home to go home to. They had been alienated from family, they had been evicted from apartments, they had nobody who would be able to provide that care for them. especially those early in the crisis that were ostracized and treated as modern-day lepers. So that became kind of a really important moment to sort of see how the sisters didn't just provide care, but advocated for meaningful reforms within the healthcare system. And even when they weren't sort of there, sort of lobbying for politicians or things like that, the very nature of the institution was a testament for what healthcare ought to be, and that it deserved to be recognized and funded and supported, even when it didn't seem to make financial sense. The mission trumped all of that. The history of the hospital reminds us that there's a moral dimension to healthcare, not just in terms of practices, but the entire healthcare system that we have. Catholic social teaching holds that healthcare is a human right, and sisters made that clear through their example. And this sort of witness and testimony continues even to this day with Catholic sisters involved in healthcare. I was really honored that Sister Carol Keehan agreed to blurb the book for me. So there's a nice little line from her on the back cover. Sister Carol Keehan was the former head of the Catholic Health Association, and she was instrumental in securing the passage of the Affordable Care Act. And her own kind of life story kind of mirrors that of so many other Catholic sisters who are involved in healthcare, where she starts off as a nurse working on the wards, but then rises up into hospital leadership and is the head of Providence Hospital in Washington, D.C., and then becomes the head of Catholic healthcare in the United States. And it was that personal experience that she had that I think really made her an effective voice for healthcare reform in the United States. She didn't approach it as a pundit. She didn't approach it as just a policy expert. She approached it as somebody who understood what healthcare did to help families. And she recognized the problems of inadequate healthcare and was able to draw upon her vast experience to speak with kind of great heart and compassion and conviction in order to steer healthcare reform in the United States. So that is one theme in the book, this story of mission. Another important theme is the Sisters of Charity and women religious in the United States. Sisters as pioneers in healthcare and the leadership that they exercised. Often within the history of Catholic healthcare in the United States, there are people who have written about the role of sisters. A lot of that literature focuses on sister nurses, going back to the Civil War and even before. And that really is remarkable. When I read the history of St. Vincent's, it is the sisters who provided the nursing care. But working on the history of St. Vincent's made me realize that, or just confirmed, that the role that the sisters had was so much more than nursing. They were kind of institution builders. They established hundreds of Catholic hospitals throughout the United States, from big cities to small towns, from rural communities to mining camps, and Catholic sisters were recruited to serve at other hospitals. The Mayo Clinic, the famous Mayo Clinic, the first nursing staff were sisters, Franciscan sisters, who were recruited by the doctors. Their reputation had preceded them. Sisters not only provided nursing care, but they owned, staffed, and operated their hospitals. It was a role for women within the healthcare system that was kind of inconceivable for much of the 19th and 20th century. When hospital administration began as a profession in the early 20th century, there was a doctor in New York City by the name of S.S. Goldwater, who was kind of a very important leader in healthcare administration. He recognized that hospitals had grown much more complex, and they could no longer be administered by doctors who needed to focus on medicine or by sort of well-meaning trustees, sort of philanthropists who maybe dabbled in hospital oversight. He said that they needed a trained core of individuals that had an understanding of both medicine and business. Well, in his mind, those were two professions that were coded male, medicine and business. So his first vision for training hospital administrators was to have a core of virile men to take on this work. Well, when the Rockefeller Foundation sponsored one of the first sort of conferences of healthcare administrators in the United States, in New York City, who was there? Sisters of Charity from St. Vincent's Hospital. I can only imagine the shock when they walked in their habits, the black habits, as opposed to sort of doctors in their white medical coats or something like that. But it was a reminder that kind of Catholic sisters didn't sort of push their way into a profession that was new. They were seeking to maintain their status and their standing within a profession that they themselves had pioneered as sister administrators of the hospitals that they had built and staffed and operated. At St. Vincent's, I didn't mention this earlier, but the Sisters of Charity not only owned the hospital, but they were the board of trustees. They made all of the major decisions within the hospital. They were responsible for its finances. They were responsible for appointing doctors to staff positions. That was truly radical at the time, but very commonplace within the Catholic healthcare system. Catholic sisters were CEOs, not just of hospitals, but Catholic healthcare systems and organized works of charity. So for the story of St. Vincent's, it's not just St. Vincent's, but it's about the work that the sisters did throughout all of their charitable institutions, the other hospitals they ran, the homes, the orphanages, all of that. This was one part of a larger system of charity. The Sisters of Charity were kind of the pioneers of organized charity in the Archdiocese of New York, even though Cardinal Hayes is often regarded as the cardinal of charity for his work in sort of systemizing Catholic charities within the Archdiocese. He was kind of piggybacking on the work that the Sisters of Charity had already done in maintaining their their institutional networks. These were women of incredible vision and faith whose labor and leadership sustained the institution and shaped it in myriad ways as they served the sick and responded to the medical needs of the day. And even though they were sort of circumscribed by their vows of poverty, chastity, and obedience, their religious vocation empowered them to take up new roles and responsibilities, often in defiance of gendered norms and expectations. Another key theme, which should come as no surprise, is the importance of nursing to St. Vincent's Hospital. From its founding days, that was one of the things that St. Vincent's promised, that it was able to provide skilled nursing care to all in need. Later on, St. Vincent's Hospital established its School of Nursing, which would train sort of tens of thousands of women, or I shouldn't say, sort of the Catholic Hospital Schools of Nursing trains tens of thousands of nurses throughout the United States. St. Vincent's, I don't think it's tens of thousands, but sort of countless numbers of young women who experienced the St. Vincent's training and then were able to sort of take that training out with them into the world, wherever they might work, whether it's in their hospital. Early on, it was often private duty nurses, where these nurses would be hired to care for sort of sick individuals within their homes. Others went on to work in the Army Medical Corps, or sort of public schools and things like that, public health nursing and other professions. But they took that St. Vincent's experience with them. The Sisters of Charity, as part of that School of Nursing, also defended hospital-based education well into the 1960s and the 1970s, as sort of nursing education had migrated into baccalaureate programs, where the college degree was seen as the standard for nursing education. The Sisters of Charity continued to insist that there was value in a practical education, a hospital school of nursing. They said that the college degrees do not provide the type of bedside care, do not provide the type of practical experience that was necessary. So they learned by doing. They were able to witness kind of all of the ins and outs of hospital care, not just from a textbook, but from the bedside, including basic lessons. One of the first lessons was how to make a bed. And it had to be done properly. At times, the hospital, I will admit, did get dinged for its over-reliance on student nurses in providing the bulk of the nursing care within the hospital, especially in kind of night duty nurses and things like that. And the school accreditors came in and said that you need to focus on the educational aspects, you have to focus on the classroom setting, as well as the bedside care. And so this did take some adjustment for St. Vincent's, where they had to rebalance the number of student nurses to graduate nurses, and that came with an expense, you know, and so this became part of the challenge of the hospital. And really kind of, it goes to the challenges of the finances of a hospital when, for much of St. Vincent's history, it relied on voluntary support, not just donations from the community, but the sisters donated their services. The students from the School of Nursing donated their services in exchange for the education they provided. The doctors volunteered their services to care for ward patients in exchange for admitting privileges to bring their patients to the private pavilion, where the doctors billed the patients separately. So much of the work of the hospital was all done for free. By the 1950s, 1960s, that became increasingly difficult. You had more staff nurses, you had more staff doctors, you had nurses' aides, you had many more sort of just staff to run the hospital. And so that was a moment of adjustment for St. Vincent's, where they had to figure out this logic, and then the challenges of reimbursement. One of the episodes that it took me a while to understand was a very long and complicated discussion about sister salaries. During the kind of the 1950s, St. Vincent's had gone through this expansion, and the hospital was at capacity. Beds were always filled. The sisters donated their services. The student nurses provided care. And yet, St. Vincent's could not break even. They were wondering, like, well, how can this be? And so Cardinal Spellman stepped in. Some of the members of the lay board of advisors offered their services, including sort of the Grace Shipping Company. Kind of some of their accountants stepped in to look at the hospital's finances sheet. And so like, how can all of this labor be done for free and you're still not turning a profit? And it became a problem of reimbursements, that St. Vincent's wasn't getting the reimbursements it was entitled to because its stated costs were so low. And the insurance companies and the city of New York only reimbursed the hospital for actual cost. And so the solution, according to the accountants, was, sisters, you have to start giving yourselves salaries. And they had to come up with salary scales for everything from the sister administrator down to the sister who's serving as kind of a dietary worker, or the sister who's working in the laundry or the sewing room. All of them needed to have a salary scale. And the sisters were hesitant to do that for a number of reasons. They also worried about raising rates because they didn't want sort of a higher charge to be kind of maybe scare patients away. But the issue of salaries sort of meant that kind of sisters were then admitting that they were employees of the hospital in a way that was not their own self-understanding of their role within these institutions. They also didn't want to be seen as somehow profiting from the care of the poor. But in the end, it was one concession to the logic of the market. Even if you donated all of that money back, on paper, you needed to give yourself a salary and pay yourself on paper to raise those stated costs so that you could get more for the hospital. Some of this this slide is a bit of a repeat, but kind of the hospital's response in times of crisis in terms of the memory of St. Vincent's. Many of you are probably aware, but after the hospital closed, they redeveloped the hospital property. And what was known as the old Triangle property became kind of the AIDS Memorial Park for New York City. And there in the walkways is a series of 6 granite medallions. And I find these so moving to go there and see St. Vincent's remembered. And it's interesting that what they remember St. Vincent's for is its response in these moments of crisis. One medallion commemorates the founding of the Sisters of Charity, but then it's also St. Vincent's and the Triangle Shirtwaist Fire, and the Titanic, and the AIDS crisis, and 9/11. You know, there are the tribute to the hospital is how it served the city in those moments. I want to conclude with 2 sort of final concluding thoughts, sort of separate from some of the comments that I've shared in other venues about the book. But one, I wanted to emphasize the importance, and I want to make sure the importance of institutions. As I mentioned at the beginning, I became interested in this story because I liked institutional histories, the stories of parishes, of churches, of schools, and now hospitals. And institutional histories kind of have a reputation for often being kind of sometimes dry and boring and things like that. But in writing the history of St. Vincent's, I hope it's not dry and boring, but I've come to an appreciation of the importance of institutions and the importance of the Sisters of Charity as institution builders. They built St. Vincent's as the embodiment of their spirit of charity. That institution stood for them and spoke for them. One of the hardest chapters I had to write was the first chapter because there was very little textual evidence. There weren't many records from the first decade of the hospital's existence. So I was struggling to figure out what to say because I was looking for the sisters' own voice, and I didn't have it. But then I realized that the institution spoke for them. The rules, the regulations, the policies, the spirit of that institution was their voice speaking out through the brick and mortar. And it really made me appreciate how the institution carried that legacy. And having the institution backing made that work of charity possible, both in the early days. It was never about an individual effort. It was never just about the nursing. It was the nursing that they provided in St. Vincent's Hospital. It was a sign, it was a symbol, it was a place. And having that institutional backing was so important later on as well. So when I think about sisters like Sister Teresita Duque, who was instrumental in establishing what was known as the Chelsea Village program for outreach to the homebound elderly. She's often presented as sort of a pioneer, this one sister who goes off and sees a need and responds to it. And that's absolutely true. But she was successful because she had the community behind her, because she had the hospital and the sisters in administration behind her, and they were willing to allow doctors to volunteer for this new initiative, even though they weren't compensated by Medicare and Medicare reimbursement rules at the time. Most other hospitals would never have allowed hospital resources to be used in that way. But the Sisters of Charity weren't bound by that logic, and they said, go for it. They provided office space. She also had experience working within the hospital, so when she needed to recruit volunteers, she had a sense of who would be a good person to help with this initiative. The same thing happened with Sister Patrice Murphy and the supportive care program during the AIDS epidemic. Yes, it was about her example and the heroic work that she did in establishing that program. But she had the hospital behind her. She had an institutional setting to carry out that work. She had support from the administration. She had support from those in the School of Nursing. She had support from the kind of the Sisters of Charity as a whole to do that work. So that would not have been possible without kind of the institution that the sisters had built and sustained over the years. And one of the last things that I will share is that one of my favorite finds in the archives, as I think about all of the sisters who worked at St. Vincent's, there are certainly those who stand out, those who are notable and those who are named. Going back to Sister Angela Hughes, at the very beginning, the founding of the hospital, she was one of the very first four. She was the biological sister of the Archbishop of New York, which certainly helped, but she was sort of part of that pioneering band. She stands out. There are others, Sister Loretto Bernard, who led the hospital's expansion. Sister Margaret Sweeney, who was sort of certainly instrumental in the 1980s in helping revive the hospital after a very difficult time in the 1970s with the urban crisis and sort of other external challenges. So often there are those who stand out, especially in leadership. But I am grateful to Sister Evelyn Schneider, who in 1980 was asked to write her remembrances of the hospital for the archives. And so there's this sort of wonderful little typescript document that was tucked away. And so she shares her experiences as she was president of the hospital and things like that. But she also offered thumbnail sketches, little portraits of all of the other sisters that she remembered working at the hospital. And it provided me with a glimpse of their personalities and their uniqueness. Sisters who otherwise probably wouldn't have been named in the hospital records themselves. So I just want to read a little excerpt here from the book where I go through this little litany of sisters, courtesy of Sister Evelyn Schneider's remembrances. But sort of, Sister Alicock Marie Buckley, a supervisor in one of the male wards, was remembered for being, quote, sensitive to the needs of the patients, most of whom were young, suffering life-threatening diseases and injuries from terrible accidents at work. Sister Maria Benigna, I've gotten that wrong, Galice, who also worked in the men's ward, exhibited, quote, a zeal for the poor and the needy that was hidden, quote, under a gruff manner. Sister Flaviana Ryan was sacristan for many years, and she made sure that the liturgical linens and vestments were, quote, always perfection. Sister Claudia Carolyn, who served at St. Vincent's for more than 7 decades, beginning in 1890, quote, knew every prelate and politician in New York. Sister M. Laura Doyle, who served in the compensation office from 1929 to 1946, quote, sifted through the many complicated problems of insurance and legalities associated with work accidents. She was praised for being pleasant, available to patients, allaying their financial fears and anxieties. Sister Miriam Benedict Murphy, Irish-born, quote, took in everything around her and appeared on duty punctually and unfailingly. Even though she was an elderly sister by the 1950s, quote, those who worked with her marveled that a person her age could be so faithful to her tasks. And so it was those little gems that reminded me of kind of all of the hidden work that the sisters did and their multiple contributions to this hospital. Some were skilled nurses and administrators, but some were also wonderful organizers who kept the file room in order, or who took care of the sacristy, or simply stood by the door to welcome families and patients into the hospital. And so I hope that the book is a tribute to all of those sisters, named and unnamed, and all those who worked alongside them to carry on this mission as successfully as they did for more than 160 years. Thank you. And of course, I'm happy to answer questions that you might have, stories or memories that you might have. I'm always eager to hear them, or anything else that might be on your mind. Oh. Yes, Mindy. We're going to get a microphone so that people tuning in can hear as well. Or you can just come and take the stage. Okay, so we did find a name for the sister who is on the front of the book. Our sort of wonderful left-handed sister here is Sister Mary Thomas Waldron. So Mindy might have more on her biography and things like that, the number of years that she served at St. Vincent's. If I remember correctly from the little bit, she was there briefly. She might have been moved to another hospital, which is another remarkable part of this story, just sort of recognizing how sisters flowed in and out of these institutions, that it wasn't just St. Vincent's, but St. Vincent's became a training ground for sisters to take on responsibilities in other community ministries. And Sister Loretto Bernard Began was very, sort of had a great deal of foresight in order to maintain that the Sisters of Charity always had sisters in training for leadership responsibilities, so that she wanted to make sure that they had the proper credentials, the proper academic degrees to take on those responsibilities, which was often a sacrifice to take sisters away from kind of the work at hand to have that kind of luxury to go on and get an advanced degree. And so she made sure that the sisters always had kind of a pipeline of talent.
Tom, the suggestion was made that we ask any sister who ever served in St. Vincent's Hospital in any capacity, please to stand. Or wave your hand.
When you talked all about the nurses, I think there are a couple of people here who really deserve honorable mention. Kevin, who the work she did in the school. And I can't see everybody. No, Karen is here. And her training and all she's did in the various places and qualities that she served in. Is there anyone else here from? Sheila. Oh, Sheila. In community, right? In the community nurses and in the other places that you served. I see a hand over there. Anybody else who's here that I can't see that Mary Segru in the services out for the community. Social work and all the wonderful things you did. Did we get everybody? I love one story about Teresita Duque. She was riding her bicycle to get from one place to another, and there was a car accident, and the bicycle got hit. She was fine, but she wouldn't do anything because she was in a hurry to go for a meeting to take care of somebody who was sick.
Mr. Mary McCormick.
I had nothing whatsoever to do with nursing of any sort, but when I was a young sister, and there are probably others in this group as well, who taught, and then in the summer we were assigned to, because God forbid you had, time off. So I was assigned to St. Vincent's Hospital, knowing absolutely nothing. But the job that I got was sewing, mending the socks of the interns.
Mending the socks of the intern doctors.
One of the sisters was responsible. Somehow, I can't remember even what her name was, but she gave me that job. So that's my claim to St. Vincent's Hospital.
Well, I mean, and the sisters sort of, the relationship between the sisters and the doctors, that's kind of another remarkable history. But when the hospital had staff housing for intern doctors, and, this is early 1900s, and kind of some of the doctors, I think, were a little bit sort of surprised, maybe taken aback, shocked when, there was a sister who was there to help them, but sort of served as like a dorm mother for the doctors who were living there, and sometimes did very kind things like shine their shoes, but other times were probably keeping track of their comings and goings and everything else. But yes, those are the kind of the sisters who were then assigned to the hospital during that summer work. That's kind of an interesting question, whether that would have been recorded on kind of the official slips for the sisters who served at the hospital. But Sister Margaret Sweeney, that's how she got her start at the hospital, sort of starting out in the accounting department, helping keep the books, and then lo and behold, they realized that her head for numbers, her math skills, had incredible practical value to the hospital, and once there, she kept going and rose to the top and became the hospital's president. Yes, please.
As a school sister, I was assigned to work during the summer with Sister Mary Thomas Waldron at St. Vincent's Harrison on the 3rd floor of St. Joseph's building. And we had 33 patients, both men and women. And she taught me a great deal at that time, which I found useful in other ways about calmness, discernment, and many other things. But I'm so glad you mentioned her. She was a wonderful woman, and it brought back memories that were challenging, but really so much to learn from.
And that sense of community within the sisters, kind of the mentorship that took place among the sisters, sort of experienced nurses training younger nurses. And that kind of sense of community, I think, extended from the Sisters of Charity into the School of Nursing, who young women who were living together in the hospital's nurses' residence. The college students that I have who are in our nursing program at Seton Hall, sort of can't fathom the idea of living in a nurse's residence for 3 years as part of their nurses' training. But the sense of community that the sisters had radiated throughout the hospital. Yeah. Please.
I was briefly at St. Vincent's as a patient in the early 1960s, and as I was being transported from the floor down to radiology, the transporter passed the stained glass window of St. Vincent and came to a screeching halt, and he said, "And now we stop and we hear the story of St. Vincent de Paul." And he told me the most beautiful story of St. Vincent de Paul, not knowing I was a sister. And I started to cry because it struck me that the seed of our mission of gospel and the mission of the Sisters of Charity were sown in everybody who worked at that hospital. He was as proud as the brain surgeons and as proud as any sister could have been and ever was. And I think that love, is still in spirit down in the Greenwich Village. I believe it is, and will never leave there.
And St. Vincent's was so good at telling its history. Sort of every brochure, every publication, every pamphlet that was produced told the story of St. Vincent's Hospital. And sometimes it was a little bit repetitious, like, why is it? But it was so important because that helped people understand the institution that they were now part of. It connected all of those other workers to that larger spirit of service, to that history, that connection to the work that they were doing, to make it about more than just themselves. And so I really do think of history as part of mission. Being able to tell that history helped make the mission sort of viable and alive over the generations.
Sister Teresa and I did not go to St. Vincent's Hospital, but I have to say that many of our instructors at the Cochrane School of Nursing that we went to were all St. Vincent graduates. And so we always had that sense of St. Vincent's coming through our bloodstream and also passed on to the nurses that worked in our hospital.
Yeah, so I see Sister Jane, but I think this is Sister Karen as well. Yeah.
I have a couple of light stories from being one of those nurses that lived for 3 years in the residence. You should see the size of the room where two of us lived. It was good that we were on different shifts because often one was on nights and one was on days and another on evenings. But many of my classmates married physicians who were residents, and some of them still tell a story. It was in the 60s. There was a sister who was a very focused house mother for the medical staff, residents, and interns. And some of them didn't pick up their clothing as she felt that they should. And one day they got back from duty, and she had brought a hammer and tacks, and every piece of clothing, socks, underwear, T-shirts, was attached to the floor in their room. So if they liked it that way, that was the way it was going to be. But when I spoke recently I had some classmates here. We're planning an anniversary celebration, and everyone says, weren't we fortunate to have the opportunity to be there for 3 years? And it was life lessons that went far beyond nursing and helped people through life. So.
And it really speaks to how much the sisters and the hospital entrusted those nurses with responsibility. Mm-hmm. That they were, sort of not just to provide medical care, but to carry on the mission. And even though they weren't doctors, they were expected to sort of have the knowledge to make sure that patients were receiving the best care possible. So the Sisters of Charity kind of, through their work, kind of elevated kind of not just sort of the St. Vincent's nurses, but nursing as a profession, as something that those young women and older women were sort of just as central to the role of this hospital as any doctor.
And some of the best doctors will say when they came as an intern, fresh out of medical school, the one who taught them the most was the nurse in charge on the unit. Mm. And we had a tradition of the Angelus prayer. The Angelus bell rang every morning at 8 and at noontime, and I think 6 o'clock in the evening. And among my friends that were gathered recently, one of them said, no matter where you were or what was going on, you stood still until the Angelus prayer was finished. You could be holding a bedpan, but you didn't move until the Angelus prayer was over. So, lots of good things.
When St. Vincent's closed, many of the doctors and nurses got jobs in other of the city hospitals, Catholic or non, and it was reported back to us over and over again. On the floors where St. Vincent's doctors and nurses were, the whole attitude of the floors changed, that the care of the sick was unbelievably different. So no matter, and a lot of them would come back and say, we're carrying on the system. It will go as long as we're in service.
There was one sort of memoir of a doctor who was an intern at St. Vincent's, and her account, she's sort of a young doctor in the 1960s, I believe, and she remembered that her very first lesson from the sisters was that here at St. Vincent's, we treat all patients as our guest. And so the doctors were expected to maintain that as kind of their cardinal rule as well. You know, so that even though this particular doctor was only at St. Vincent's briefly, that lesson stayed with her for the remainder of her career.
Just one more thing. I recall somewhere early in our education, we were taught never to judge what brought a patient to the state that they're in when you meet them the first time. That doesn't matter. What matters is what's in front of you and focus on how you can help the person. But I really think that lack of judging is important and has been important in my life and development.
A few sisters, Sister Alice has passed away, but 4 or 5 of us began to ask questions. Children coming into the classroom, and they had bruises. And mothers said, "Oh, he always strips." And we began to write that in a systematic way. And somehow Dr. Fontana, I can't give you his dateline, he was the one that instructed us, because he said children were thrown downstairs and nothing happened. It was the x-rays were not available until the early 40s and then the 50s. And that's when we began to understand that a parent was abusive to the child. And in some instances, we brought them to court, and they had their own therapy, etc. Some were healing, and others were continuing with problems.
Mm-hmm. Yeah, Dr. Fontana, his work was one of the things that unfortunately I didn't get to sort of cover in the book, but he was a pioneer in the understanding of abuse. But it also reminded me that how the history of St. Vincent's Hospital and the Sisters of Charity, that there's another book to be written, I don't know if by me or by somebody else, but on sort of child welfare and kind of the sisters' emphasis on caring for children, going back to orphanages, but then also the foundling hospital and kind of these networks of institutions that all focused on the child. At St. Vincent's, in the 1930s, St. Vincent's established kind of a formal pediatrics department. You know, before you had simply the children's ward, but then to sort of transfer that and make it a formal pediatrics department. But then this emphasis on the investment in a neonatal intensive care unit that became one of the best NICUs in New York City, where infants were transferred to St. Vincent specifically for that. So there's kind of a whole history there about how the sisters emphasized caring for children that was reflected in all of their ministries. Oh, but thank you again for kind of the warm welcome and the opportunity to share this story with you.
Tom has given us, I think, his ministry of carrying on the mission has been the ministry of recording it and documenting it and researching it and ferreting it out and shaping the story into a marvelous tribute. So we thank you for that.
My pleasure. And I was going to say, there are a couple books that are in circulation right now, but more I'm sure will be on their way. I did bring a few copies of kind of Xeroxes of the introduction to the book. If anybody's interested, we can leave these somewhere here. You know, kind of I'll let kind of the staff here figure out where best to place these. But if anybody wants to get a little taste of the book, the introduction is here for all of you to enjoy.